Mr. Pritam Singh.
Sir, the Workers' Party MPs have raised points which cover the main prongs of the Healthier SG white paper. These include concerns on capitation funding, manpower issues across the healthcare landscape, and the future evolution of the family medicine ecosystem as envisaged, amongst other points. The upcoming changes to the healthcare system underwritten by the white paper are significant, and in the main, the Workers' Party supports the government's strategic shift towards preventive healthcare, important aspects of which were preemptively raised by Workers' Party MP Leon Pereira in his adjournment motion on reviewing strategies towards preventive healthcare in February this year. My contribution to this motion will be short, and it covers an important but sometimes understated stakeholder in the public healthcare ecosystem. And that stakeholder are the traditional Chinese medicine practitioners and others who are practitioners of alternative or complementary medicine. In the course of the debate, I have heard honourable members Joan Pereira, Henny So, and Mr. Yip Hon Wing also speak on TCM and how it interfaces with the Healthier SG white paper. In my speech today, I will make 3 suggestions to bridge TCM and complementary or alternative medicine as important community partners of a Healthier SG. In July this year, I asked the Minister for Health in a written parliamentary question how TCM practitioners would be integrated into the ministry's Healthier SG plans. Minister Ong replied, and I quote, "Traditional Chinese medicine practitioners are important stakeholders, especially given their emphasis on holistic and long-term care. However, unlike Western doctors, traditional Chinese medicine practitioners are not tightly regulated by the Ministry of Health. The standard of care delivery varies widely, and we will therefore not be able to take the same approach as we have taken for Western doctors," unquote. This reply is nonetheless not inconsistent with the Minister's public comments in December 2021, where Minister was quoted as recognizing the benefits of TCM in fighting chronic diseases. In fact, successive health ministers have raised hopes of alternative approaches to healthcare, like TCM, which complement and integrate Western medicine. Some almost 30 years ago, in 1995, the Health Ministry accepted the recommendations of the Committee on Traditional Chinese Medicine and moved to begin regulating TCM. Globally, under the Beijing Declaration adopted by the World Health Organization in November 2008, traditional Chinese medicine was recognized as having an important role in the improvement of public health. Acupuncture has in fact been scientifically proven through trials conducted by the WHO, through trials recognized by the WHO, I beg your pardon, to be an effective treatment for more than 20 diseases and disorders. Today, TCM practitioners in Singapore are governed by the Traditional Chinese Medicine Practitioners Act, and physicians are expected to abide by the ethical code and ethical guidelines for TCM practitioners issued by the TCM Practitioners Board, which also comes under the Ministry of Health. In 2019, new legislative changes were made to further professionalize the TCM industry. These included the introduction of continuing professional education and raising the maximum fines on errant practitioners from $10,000 to $50,000. This hike in fines brought the TCM Practitioners Board's disciplinary powers in line with those in the dental, pharmaceutical, and allied healthcare boards. So TCM and other alternative treatments such as Ayurveda and other alternative therapies have a long tradition of acceptance in various Asian cultures. Singapore is no different, with non-Chinese Singaporeans resorting to TCM and alternative medicine as well. To this end, some TCM products have even been halal certified. In fact, as early as 2005, the Ministry of Health allowed licensed hospitals and nursing homes to have full-service TCM clinics, including acupuncture, tuina, and herbal medicine services to be co-located on their premises on the condition that the TCM clinic was clearly distinct from conventional medical services. In 2018, an acupuncturist at Khoo Teck Puat Hospital was quoted in the newspapers as saying that around 40% of her patients who sought acupuncture were non-Chinese, and under the age of 25. The government, for its part, has previously allocated $3 million for the TCM clinical research grant from fiscal years 2013 to 2018 to support research into chronic diseases. A further $10 million in research and development grants was also announced in 2017 as part of efforts to modernize the industry. Then Senior Minister for Health, Mr. Chee Hong Tat, was quoted as saying, "After you come out of hospital, how do you help a person to get back as quickly as possible to good health? I think things like therapeutic massage actually play a very useful role," unquote. On the 29th of December 2020, in a significant move, the Ministry of Health announced that it was extending means-tested subsidies and Medisave coverage under a pilot arrangement to support acupuncture for lower back pain and neck pain at specialist outpatient clinics in public healthcare institutions. The pilot did not cover acupuncture used to treat other pain indications and other forms of traditional, complementary, and alternative medicine offered at public healthcare institutions. However, the ministry stated that it would review the expansion of the pilot to other settings in the longer term, taking into account learnings and data from this pilot. Healthier SG may well provide the opportune platform and impetus to expand this pilot. Suggestion 1, extending use of Medisave to more procedures and allow TCM practitioners to offer them. To this end, sir, my first suggestion is for the government to consider extending the use of Medisave for more TCM procedures and alternative therapies that have a proven role in the management of one's general health and, more pertinently, in the prevention of chronic diseases. This expansion should also see the inclusion of certified TCM practitioners who can be allowed to offer such approved procedures in their TCM clinics outside public healthcare institutions. In order to prevent abuse, a fixed and audited list of procedures and caps to limit the fees that can be charged for such procedures ought to be considered. Additional subsidies can also be extended to Pioneer and Merdeka card holders for these procedures, many of whom resort to TCM as an important source of primary care. Suggestion 2, consider alternative and complementary medicine to lower costs. Secondly, the Ministry of Health should look into the cost of alternative medicine that substantively produce the same clinical outcomes as medicines and drugs disbursed by our public healthcare institutions. For example, Fibogel, which is commonly dispensed for constipation, can cost around $20 on the shelf without subsidies, whereas psyllium husk, which confers similar if not identical benefits, can be purchased from Little India and even NTUC supermarkets at under $3. In 2015, the then head of the Traditional and Complementary Medicine branch of the Primary and Community Care Division at the Ministry of Health confirmed, and I quote, that MOH constantly reviews the regulations and policies on TCM, taking into consideration the scientific advancements and rising standards of TCM. In similar vein, and with a view to better manage costs, a review of commonly prescribed medicine, which substantially produces the same clinical outcomes as complementary medicine, should be undertaken on a longer-term basis. It would be useful to understand if the ministry or a relevant body like the Health Sciences Authority currently carries out such comparison of clinical outcomes between Western and alternative medicine with a view to lower overall healthcare costs. Separately, I suspect more than a few in this House would have encountered cervical episodes for which traction and other specific thoracic mobility stretches are commonly prescribed through physiotherapy. Similarly, TCM also advances traction and certain stretching and mobility exercises as rehabilitative procedures. In this light, would the ministry consider whether there is scope for such rehabilitation or physiotherapy to be undertaken at TCM clinics by TCM practitioners? Such rehabilitation is not usually just more affordable than physiotherapy sessions at many private and public healthcare facilities, but the convenience of having such options for Singaporeans within one's neighborhood and perhaps right under one's block can ensure that patients complete their rehabilitation and live healthier and more mobile lives. Suggestion 3, leverage on TCM practitioners to achieve healthier SG. Mr. Deputy Speaker, late last year, a Straits Times article reported that the government's feedback channel Reach discovered that many seniors were reluctant to get their COVID-19 vaccines due to, and I quote, advice from their doctors, mostly traditional Chinese medicine practitioners, who were unsure of what advice to give, unquote. In response to this, the Ministry of Health arranged to meet all TCM practitioners to explain why vaccination was critical. So while TCM and other alternative therapies have not been covered in any substantive detail in the white paper, it is clear that TCM practitioners do not have a small footprint in the mindshare of Singaporeans when it comes to our health, particularly in the heartlands. Like Healthier SG, prevention of long-term diseases is a core belief of TCM and complementary medicine. And this does not start in one's senior years. Their treatment philosophy places an acute focus on prevention before a disease arises. They advance the view that one's lifestyle is intimately related to health, which can be improved through effective mental health management, rest, a good diet, and interventions based on a person's specific physical conditions, amongst others. By watching such indicators, one is well on his or her way to good health, regardless which economic strata of society one belongs to. Indeed, the white paper lists a number of community partners such as AIC, Sports Singapore, the People's Association, and the National Parks Board that will empower residents to chart their own journey towards healthy and active lives. In our journey to live more healthy lives, I would suggest that we should not underestimate the wide reach of the local senseis in our neighborhoods. MOH should tap on them to help share healthy living tips and preventive healthcare strategies, and not just to our seniors. And MOH should not rule out subsidizing TCM practitioners in this endeavor, subject to their contributions towards objective criteria under Healthier SG. Such an approach would also be consistent with the aim of successive ministers of health who had hoped to integrate Western medicine and TCM and alternative medicine as far as practicable, even as both branches of medicine operate in different cultural and professional milieus. While progress in this regard appears to have been fitful so far, Healthier SG provides a newfound opportunity for TCM and alternative medicine to play a more active role in the primary healthcare space and in preventive healthcare. In conclusion, sir, just like family doctors, many Singaporeans have been going to the same TCM practitioners for decades. For some, the reasons behind this may well be behavioral, peace of mind, and more comfort dealing with a TCM practitioner. The government is on record to say that TCM practitioners are an important stakeholder in Healthier SG. The ministry should consider concrete plans and strategies to include them in the country's strategic shift towards preventive healthcare, as Healthier SG is fleshed out and operationalized in the months and years ahead. The ministry will not be starting from ground zero. With decades of regulatory experience and periodic reviews of the TCM landscape undertaken by the TCM Practitioners Board, a dedicated effort must be undertaken, driven by the ministry, to draw on the treasure trove of alternative and complementary medicine that has been relied on by generations of Singaporeans for their well-being. This is an opportunity that should not be missed. Thank you.